Hello, this is Steve Parker of Elite Therapy Solutions of Richardson, Texas. Also sportsmedcentral.net. Today I want to discuss the Parker drawer. I developed this test about 30 years ago when I realized with these small hands I could not manipulate a 250-pound linebacker's knee to tell whether he tore his ACL or not. So what happens? A patient or player tears an ACL on the field. They're freaking out. The bones sublux over the top of each other. You got to look at the knee and rule out a couple of things before you even check the ACL. If the knee blows up like a balloon, might be a fracture, might have subluxed the patella or the kneecap. So you got to rule those two things out. Also, you need to check distal pulse down around the ankle bone. Make sure there's a pulse. Sometimes when you sublux the knee from an ACL tear, you will cut off the artery to the foot. Once you decided that the knee is stable enough to check the ACL, then you go to the next route. And from here, we're going to take a little different angles. I want you to get right down into it. The next thing I'd like to discuss is the mechanics of the injury. How do you tear an ACL? The two most common ways are the internal rotation. After a blow to the outside, you end up tearing your MCL as well as the ACL. Then the other way to do it is hyperextension of the knee will also tear the ACL where the knee goes backwards. We ask for the symptoms, and once again, usually an ACL tear, there's no immediate swelling. The bone bruise, when the bones sublux on each other, which means they kind of partially dislocate, you'll get a bone bruise, and that will ooze overnight. So it'll bleed out overnight. We can check the suprapatellar bursa by milking the bursa sac down. Here's the kneecap, here's the joint line, here's the MCL. You milk the suprapatellar bursa down and feel along the joint line to make sure there's no swelling. And if there isn't, and there's posterior lateral pain. So if you're going to get pain from an ACL, the most common symptom is behind the knee, back here, behind the knee, just a little bit to the outside. It's called posterior lateral pain. So we put the patient is in a position where they've just sometimes felt the worst pain of their life, so you have to settle them down a little bit to get them to relax. And it's hard to get them to relax when you're grabbing their leg up in the air and start jerking them back and forth with the normal test. So I developed this one because I wanted to make sure the hamstrings are not kicking in during the test. So I put my knee and leg up underneath the hamstring like such, and I use the top of my thigh to decide whether the hamstrings are tight or loose. So now once I feel the hamstrings are loose, I cup the patella, and I'll take my pointer finger and stick it right on the joint line. So I want to tell how much excursion of the tibia on the femur. Okay, we cup the kneecap, the patella, use the pointer finger along the joint line to feel the excursion of the tibia on the femur. Put the other opposite hand up underneath the calf, top of the calf muscle, and you feel a little clunk. And this ACL is very tight. And to get the PCL, you go backwards with back pressure, and you get the PCL as well. At this point, you can do the MCL because it's a perfect position to do the MCL, and you can actually feel sometimes the cartilage goes slide in, back and forth. And you can feel the edge of the cartilage. But the ACL feels excellent. He's getting about maybe a millimeter, if that, of excursion. This is one of the tightest ACLs I felt. The other thing you can do is check the PCL. A good test is to get the tibial tuberosity where the Osgood-Schlatter's ends up with the top of the tibia, and just push back, and he's tight as a drum. I wish I had some of my PCLs that I've had in here lately, because I've had a lot of PCL tears lately. But once again, cup the patella, joint line with the finger, pull up. Overnight, you'll notice the knee starts swelling. Most of the swelling will be here in the top of the suprapatellar bursa. Sometimes the kneecap will look like it's floating. Don't be alarmed as long as there's still blood flow to the foot. Shouldn't be a problem. Need crutches and a wrap. take the wrap off before you go to bed, ice it on and off, 15-20 minutes at a time, off an hour, 15-20 minutes at a time, elevate it, get into your orthopedic surgeon, the one that does the most ACLs that you know and does a good job. Get in to see them very quickly. Thank you very much.